Hello class, my name is Adi Paraon and this is my crisis management presentation about managing health information systems and records during a health pandemic. What is a pandemic? A pandemic is a sudden severe outbreak of disease that spreads throughout the whole region, continent, or the rest of the world from vulnerable populations. This word came from the Greek origin of pandemos, which means all the people. The importance of health information systems pandemic planning. This type of crisis is important to address because the government relies on the important data that is being analyzed and gathered by health information systems nationwide. It is vital to gather the data to interpret where the disease originated so that the government can create and enforce a policy to mitigate the appropriate resources for efficient medical care. Data gathered from health information systems and electronic health and medical records are important for scientists to create and predict models for the national health systems to follow for the pandemic's future outlook. The routine collection of public health, facility and patient data from hospitals, medical providers, and other public health sectors can be used to consider what kind of technology is used and how it can be improved, and how to improve medical personnel efficiency by training them to use better health informatics practice, and how it can benefit the area's population and health infrastructure with sustainability. There are four disaster planning types to use in a pandemic for health information systems. The first one is prevention, identifying gaps within the health information system scope by providing education for infection prevention, incorporating artificial intelligence and deep learning to develop and forecast pandemic models. The second step is preparedness, developing a decision support health system for clinical and administrative goals improvement of outdated IT infrastructure within the facility and region to support HIT. The third one is response. Improve response time to pandemic by utilizing all technologies available in the health IT systems. Develop a good strategic plan for prevention and preparation phase to have a better pandemic outcome. Last but not least is recovery. Use telehealth and telemedicine to provide crisis management support during pandemic, using big data and decision support systems for clinical and health IT management. In order for you to successfully manage a health information system during a pandemic, you must have the following management skills. Leadership is needed to effectively communicate your strategic plan and vision to other team members in the health information technology sector. Risk assessment is essential to find the needs of the infrastructure, identify its resources, and plan the appropriate action of response. Digital skill sets and health IT proficiency is needed for someone managing health systems during a pandemic. Innovation and proactiveness is needed for managing health systems and records following the strategic plan for business continuity during a pandemic. There are two important resources in order for you to necessarily manage health information technology during a pandemic. The first one is improving the HIT infrastructure. In order for health information technology systems and records to thrive during the pandemic, we need to ensure that all computer hardware and infrastructures such as servers, network cabling, routers, switches, power generators, and cooling units are all maintained and up to date to accommodate the load work and bandwidth during peak hours, since it is working 24/7. Electronic health records and other HIT-related software should also be maintained to continually provide significant data for public health use. The second resource is to have skilled, quality manpower. Health systems and records require staffing who are both knowledgeable in computers and healthcare to effectively manage during a pandemic. Essential training is required for managing big data and records to assess where it is needed and to effectively used for by medical providers and general public. A strong leader who knows how to react, adopt, and enforce on a short amount of time is needed to significantly protect the security and privacy of information in health records and systems as needed. There are two great examples how health IT has been managed during a pandemic. The first one is the H1N1 virus in USA. This swine flu pandemic has proved that health information is essential to provide data across the globe. Hospitals and healthcare facilities were not all using electronic health and medical records at that time, and this shows how health information is transferred to provide the best medical care from patient to provider. As a result, hospitals and also medical facilities in the United States are promoting e-health technologies and resources throughout the whole management system to prevent future pandemics alike. The second is the COVID-19 pandemic. 19 European countries were able to handle the data surge during the pandemic by improving and advancing their health information systems that controls the area and region. As a result, the widespread research of vaccination has begun, and with the data gathered from reliable sources, we have developed a vaccine that will prevent COVID-19, and we are now closer to the great cure. And these are my following references. Thank you for watching my presentation, and have a great day.